Hello everyone, welcome to another session of Ask FUH, the informative and educative session that we have been conducting for a long time. So today we are here specifically to talk about and focus on men's health, right? So at Fakeeh University Hospital, we are also running a campaign called About Him, which emphasizes on men's health. So joining us today is Dr. Deepak. Dr. Deepak is our consultant urologist at Fakeeh University Hospital, who will shed more light and information on men's health. Welcome, Dr. Deepak, to the show.
Thank you. So as he said, November is considered to be the Men's Health Month. Now, if you look at things, the woman's health is considered to be of utmost importance. You have months for breast cancer, a month for cervical cancer, but often the men's health is neglected.
Ignored. Okay.
Ignored. Maybe it's because everybody is busy working, but men's health is often ignored and they usually don't take care of their health. So November is a month that they can take care of their health, get well, and take care of their family as well. That's why we have something called November, otherwise called Movember.
Movember also, right? Okay. Doctor, when we talk about men's health, there is one common word that we always keep hearing, that is prostate, right? So I want to understand from you, on behalf of the larger male audience, so what is prostate gland?
Okay. So if you look at men's health, there are two important things that comes into picture. One is prostate, one is sexual problems. So because you asked about prostate is a gland seen only in men. So there's no prostate in women, only men has got prostate. So the function of prostate gland is to secrete something which creates a parts of your semen. So the prostate enlarges in size as the males grow. So after 40 to 45 years, you get some kind of symptoms for prostate enlargement. Your urine speed tends to become slow. You need to go to the washroom very often. You don't get a good sleep at night. You have to visit the washroom. You feel that the urine is completely not gone. So all these are symptoms of enlarged prostate gland. But what we are worried is another problem, the prostate cancer. When the prostate enlarges, you have symptoms. But when there is a cancer within the prostate, there are no symptoms. So unless and until you check for a cancer within the prostate, you will not know that there is a cancer within the prostate unless it spreads to other parts of the body.
So what are the typical symptoms of a prostate problem?
So enlargement of the prostate is not cancer. So when a prostate enlarges, as I said, the urine speed can come down. You may feel to visit the washroom many times. You feel that you have not completely emptied the urine. So all these are symptoms of enlarged prostate. But as I said, when you have a cancer within the prostate, you don't have any symptoms. So that's the reason why we say men's health has to be taken care of. They need to check their prostate to see if there's any prostate cancer.
Okay, so ideally you're saying that we don't have to wait for a symptom to come up. It should be a screening, that a man, mostly I think about the age of 40, that has to, they have to screen their prostate.
That is correct. That is correct. That's because the prostate cancer, unlike any other cancers, the prostate cancer does not have any symptoms. You will not even know. So the prostate cancer is detected by a simple blood test called the PSA. So PSA is a blood test wherein you can indirectly see if there is a evidence of prostate cancer.
Okay.
So by just getting a urology consultation and a blood check of PSA, you will know if you have an early prostate cancer or not.
Okay. So the age specific is only 40 and above, or people who are in their 30s should also be worried?
Prostate cancer is usually seen in men above 40 years.
Okay.
But infections in the prostate are seen in men below 40 years of age. So if we are looking at prostate cancer, then we are looking at people above 40 years of age. But as I said before, there is another problem in men's health, that is the erectile dysfunction. Now, of late we see a lot of young people coming in with erectile dysfunction, people in 20s, people in 30s who has got erectile dysfunction. They come late to us because they're very shy to talk about it.
Correct.
So I think this is a month wherein you should feel that this is the time for you to visit a urologist to discuss about all your men's
Let
health.
go of the shyness and
Exactly. So this is the month that everybody should come in, visit your urologist, talk about your health, talk about your sexual health, talk about your prostate health, and I think it will make a big difference in your personal life.
correct. And out of curiosity, on behalf of the male population, I want to ask you, when does one need to be concerned about their sexual health? Like, when do they need to see the doctor? Because unlike prostate, I don't think so there is a screening associated with sexual health. It's only when you realize that something is wrong. So one might not see that as an ED problem, or one might not really able to ascertain that there could be an issue with the sexual health. So when do they actually need to visit a urologist, possibly for a sexual health issue?
Now, if you look at the sexual problem, most of the men visit the urologist when they are forced to visit because of the wife. So they come to us only when the wife says, okay, you need some treatment, go and see the urologist. So I would say, if you are psychologically not well, you're not able to have a sexual intercourse up to your expectation or up to your wife's expectation, then I think it's time to visit a urologist and just take help. Because most of the times it is curable. We can give you some medications, you get better to normal.
Yeah. And it's it's very surprising that you're saying the young population is also somehow associating themselves with sexual issues. And usually the perception is that once you get older you might have such issues, but then younger population. So I think this conversation is very helpful, not only for the older population but also for the younger ones, to sort of realize that if anything is disturbing them sexually, it's very important they have to visit a urologist for consultation and or for screening.
Yeah, that's correct. So before, what we usually see was people above 50 years of age coming to us with sexual dysfunction. But then of late we see people in their 20s and 30s.
Yeah.
Maybe it's the stress, maybe it's a psychological factor. But
Is it also associated with obesity perhaps? Is it associated with food? I mean, we're curious to understand what are the possible association for this issue.
Yeah, that's a good question. When there is obesity, what can happen is your testosterone can come down. So when your testosterone come down, your interest to have a sexual intercourse, that is libido, and the erection can come down. And when you're obese, there is a good chance that your cholesterol is high, you may have diabetes, hypertension. All these can reduce the blood flow to the penis and cause a reduced erection. So obesity is a factor for erectile dysfunction. But then there is a stress factor, a psychological factor, which adds up for the erectile dysfunction in young. There's something called a performance anxiety as well, wherein they think that they're not able to perform well, and that creates a erectile dysfunction as well. So we in the urology department take care of the psychological and the physiological erectile dysfunctions.
Wonderful. Doctor, thank you so much for this absolutely frank conversation regarding men's health. I'm pretty sure this is very informative, and it might also encourage men to more often visit the urologist for their health, and which might ultimately ensure that they live a prosperous and a happy life, right? So
thank you.
Anything else you would like to add from your side?
So I think the whole stigma of going to a urologist for a sexual problem, I think that should be off your mind, and you should just come and visit us. We can help you in all your problems.
Absolutely, I agree with you on that. Thank you so much for the audience. This has been a wonderful session, and we will come up with more such informative and educative session. Cheers.
Thank you.